The opiate crisis has been something that we have seen on a national, state, and local level. It's happening everywhere, in every community. We are seeing more and more and more people using opiates in Indiana, in our rural communities, in our metropolitan communities.
Southern Indiana saw a significant HIV outbreak in the last couple of years, and it was directly related to injection drug use and from individuals who were sharing needles during that time period. So any time that you have somebody that's HIV infected and they're sharing needles, that increases the risk for an outbreak of HIV, and that's something that we're trying to avoid here in Northeast Indiana.
The number one way HIV is spread is through sexual contact. However, the highest risk way that it is spread through sharing needles.
If one person is infected with HIV and they share that needle with one other person, then there's a 97% chance that that other person will be infected with HIV. So as far as I'm concerned, it takes one person to generate a crisis.
And the reason being is because HIV lives inside of a needle for a very long time, and it's going into a direct opening right into somebody's vein.
Some people feel that they are not at risk, and I have to inform them that the H in HIV actually stands for human, and that covers us all.
Our mission at the Northeast Indiana Positive Resource Connection basically is to reduce and eliminate the number of new HIV, AIDS, hepatitis C, and SD infections that occur in Northeast Indiana.
HIV doesn't discriminate between one kind of person and another. It can infect any human being.
HIV is kind of like any other disease. The sooner you know, the better.
At PRC, we really strive for those to know their status by getting tested. To know your status is to be empowered so that you can make better decisions within your life, and so can others around you.
When the client comes in, I want to make sure that they're comfortable, so I'll ask them some questions just to kind of set them off their focus on the fear of what that test result might be.
And try to make sure I convey the information in a way that they can relate to, in words and terms that they understand.
When a person comes in to have a hepatitis C test, they're in a more comfortable office setting. They get a little finger stick from a very small needle, so some people don't even feel it. A drop of blood is then put into the vial and the test strip is put in that, and 20 minutes later they get their results. When a client comes in for a HIV test, they're coming into a pretty comfortable office and sitting in a comfortable chair. They don't have to have a blood sample taken for an HIV test, so they just take that swab and they run it through their mouth, put it in the vial, and then in 20 minutes the results are ready.
If we have a new individual that's come into our agency that's HIV positive, we're going to embrace that individual and we're going to work with them in a very comprehensive manner to get them the help that they need. Ultimately, we want to get them connected with an infectious disease doctor who then can get them on the appropriate regimen so that they can become an individual whose viral load is undetectable and their CD4 count is high, which means they will not progress on to an AIDS diagnosis, and they won't be able to transmit the virus to someone else.
If you receive medical treatment for HIV, your life expectancy is the same as anyone else's. Many people live to their 70s or 80s.
And here's the thing, a lot of times people are out there, they're putting themselves at risk, they're not getting tested, they're HIV positive, they don't know they have it because they've not been tested, they don't go into treatment, they don't get on the medications, they don't adhere to those medications. Plain and simple, they're going to die. Ultimately, we are trying to prevent death for people living with HIV.
I have been in the AIDS field since 1988, so having seen the progress in the last 30 plus years is amazing. Back in the day, we really didn't have a lot of resources, and I think it pretty much was considered a death sentence. It is so different today. So what helps me get up in the morning is knowing that we're able to help people manage this infection, prevent it from being spread to other individuals. They're healthy, our community is healthy, and it's putting that new information out there so that people aren't so stigmatized by it, and they're not going to face the traumatic medical conditions that people did in the early 1990s.